welcome to Turn the Page, the official podcast of the Syosset Public Library.
Hi, welcome to Syosset Library's Turn the Page podcast. I am Jessica. I'm your host, and I am here with an author who we were just chatting before this. This is your third book that's come out this year.
Yes, yep.
Yeah, Caitlin Starling, welcome to the podcast for the first time, even though you've had two other books come out before this. We're talking about the Graceview Patient, which is, man, if you do not like hospitals, this is probably the most horrifying book you will read. It's about a woman with a very rare autoimmune disease that becomes she's like a trial patient for a treatment, and things just go downhill from there. Welcome, first of all.
Yeah, thank you for having me on.
Thank you for coming. Tell us about the Graceview Patient and where this book began for you.
Yeah, so you covered basically the initial premise pretty well. Meg is in an inpatient stay in this hospital she's signed up for at least a month. They're going to destroy and rebuild her immune system. And as things get going, it becomes unclear whether the symptoms she's experiencing are because of the medication she's on or because of something sinister going on in the hospital or living in the hospital. I like to describe the book as the yellow wallpaper by way of House MD. And it is honestly born out of my love for the medical profession, which I feel like seems very strange to some people because it is a horror story set in a hospital. I like to call it hospital gothic. But it came out of actually a short inpatient stay of my own after my kid was born. It was unexpectedly dramatic. There were blood transfusions involved. I was in the hospital for maybe 5 days. My kids stayed a bit longer in the NICU. Everything's fine now. And I think a lot of people, when they hear the story of all that went down there, think, oh my God, that's a very traumatizing birth story. And for me, it wasn't. I think a lot of that was down to, I had some really good nurses. I understood what was happening and what the problems were and where we're trying to do things. And I also came into it with a lot of background medical knowledge. I'm not medically trained, but I am a huge nerd about that sort of stuff. So I understood a lot of the things as they came up. And after that experience, I was pondering, what kind of story I would like to write next. And I decided I wanted to do something about a hospital stay, but specifically where the horror, the antagonists weren't evil doctors or evil nurses. These are the nurses in this book, by and large, are just trying to do their jobs and try and take care of Meg, who is honestly a patient from hell in some ways. She's not trying to be, but the things that she is experiencing make her erratic and unreliable and scared. And
as it would.
Yeah.
It's very uncomfortable being in a hospital. It
Yeah.
really is. And time passes in a weird way. It does, it doesn't make a ton of sense.
Yeah. I've had a lot of relatives who have had prolonged stays. My own mother was in and out of the hospitals a lot when I was a kid. And yeah, there is definitely a thing. There's a term for it, even ICU delirium. It's most present in the ICU because you're sedated a lot more and things are a lot weirder in the ICU than in a lot of areas of the hospital. But any prolonged stay, because of how a hospital works, you're going to get disoriented. You're going to be sleep deprived. Your sleep's going to be fragmented. And there are ways that nurses and care teams have of trying to keep you oriented during that. But I mean, that's the real reason that they want your hospital stay to be as short as possible, is because there are trade-offs to being in a hospital. Hospitals are a great place to get certain things fixed, and they will do other things to you that you don't like. Kind of just, like hospital acquired infections and things like that are to a certain extent unavoidable. You can mitigate the risks, but you can't take them away entirely. And I had a real fun time playing with that and trying to do it in a way that was, very, very empathetic to all sides of it. I'm trying to keep in mind how the nurses must feel dealing with a character she's a protagonist in a book, right? We want her to try and solve the problem that she's experiencing. We want to trust her. But some of the things she does put people around her at risk, let's say.
You captured it all really well and horrifyingly. You know, I was very curious about the condition, Fayette-Garrett syndrome.
Mm-hmm.
If you could talk a little bit about it, and is it based on anything specific? Like, because immediately my first instinct was, oh, let me look this thing up. Oh, it doesn't exist.
It's named after my mom. But she actually had HIV/AIDS, so related but different from your normal autoimmune condition. It is it is entirely fictional. It is largely, I will admit, for the convenience of the plot, what it actually does to the body. But it's based in a lot of real autoimmune conditions. I personally have psoriasis, which sounds like it's just a skin condition until you learn that it can also destroy your joints and do other terrible things. But any autoimmune condition is tricky for a lot of reasons. They don't really usually have clear causes. They don't usually have clear treatments. They can affect seemingly unrelated parts of the body. In Meg's case, it mostly affects her skin and her digestion, but she also has liver issues. Basically, I decided that this one largely impacts parts of the body that have high cell turnover rates. So your skin replenishes itself pretty often, your stomach lining does, and your liver gets infected by that too. And the struggle with autoimmune conditions is, of course, that it's your own body that has gone haywire and is targeting part of your body that it doesn't see as itself, which is inherently a really terrifying concept. And but part of why it was so useful for this in particular is that you can imagine experimental treatments that would do something like, okay, we're going to destroy your immune system and rebuild it and retrain it. That sounds like a reasonable way to do it. It also comes with some really scary risks of, well, what does that mean? But it also let me, if I needed a symptom that was new and exciting and really freaky, I could kind of figure one out. There's a sequence in the book that involves a very upsetting menstruation related problem that is a combination of the medication that she's on, the fact that she had to go off her birth control before she came into the program, and the way her condition and all those three things interact to produce a very weird dream nightmare sequence of a medical incident that is a real thing. That is a thing that can happen to people. I don't want to spoil it too much, but when you hit it, just know that that is a thing. There are pictures that I looked up to be able to describe what happens in that scene.
Yeah, that was my next part of my just questioning was just like, what kind of research? I mean, you mentioned you're a huge nerd. What kind of research did you do to, I mean, make this feel as real as it did? I think you really feel dropped into that hospital with Meg, and that every time she's poked and prodded and something happens, it's like it's happening to you. It is
Yeah.
just such a visceral experience.
Well, I had a friend of mine. I have a friend. She is now a care coordinator nurse, but she used to be an ER nurse. She's also a writer, and I was able to grill her whenever I needed to on how certain things would be handled in a hospital. And eventually I hired her to go through the whole first draft, identify everywhere that I was incorrect or that there was a more interesting way and more accurate way to do something. And she would flag it for me and we would go through and fix it up. There was a point where I was like, okay, I texted her, I'm like, you haven't read this book yet. And I want to start off by saying what this character is doing is stupid and it's going to have consequences. But if she were to try and set up her IV to do XYZ, how would she do it? and my friend was luckily very happy to help with that. She wrote me a beautiful document of along with the specific notes that she had, more general notes on hospital functioning and what it's like to be in a hospital long term, and sort of the sounds and sights and smells and everything that kind of goes along with that. And then I combine that with my own experience being in the hospital and visiting my son in the NICU and childhood experiences with my mom. And then also there is an amazing book called The Year of the Nurse by I can't remember how she styled her name for that, but I think it's it might be Cassandra Alexander, but it's The Year of the Nurse, and it is a memoir of this nurse who she's an ICU nurse, and she was on the front lines during the height of COVID, and she wrote it to process that year. In hindsight, her therapist prompted her to do it, and it has some really raw and powerful details about what it's like. There's a character in the book, Isabel, who is the way she is because of reading that book, The Year of the Nurse. That Isabel is burned out on the other side of something very similar, and is having trouble balancing her impulse to do her job well versus her empathy or lack thereof with her patients, because it's safer not to care as much anymore. And yeah, that's a lot of it. I talked also to another nurse. I talked to one of my mother's nurses, actually, because he was on the front lines of working with doctors and pharmaceutical companies to develop the early trials for AIDS patients and those medications. So I got a window into, it's very like, I assumed that medical trials were like a pharmaceutical company shows up and goes, let's run this trial. And so I think sometimes that's the case, especially these days. But during like the AIDS crisis, it was very collaborative, and it was the doctors and the nurses were like, this is what we're seeing in our patients. This is what we want a medication to do. Do you have anything that'll fit that? Or we have on our own combined these two things and we're seeing good results. Can we formally test this somehow in our clinic? And so I got to pull, I will say that the pharmaceutical testing in this book is exaggerated for dramatic effect. Similarly, there's I said, my friend is a care coordinator nurse. Meg does not have a care coordinator nurse. A lot of the things in the book would not happen if she had a care coordinator nurse. So I do also want to say that, like, while I tried to go for realism, I don't want anyone to be scared off of like seeking care or going through. My mom did a bunch of experimental trials, some of which were great and some of which didn't help at all and were miserable. That stuff is actually very good and valuable, but it's also really fertile ground for a book like this.
Of course. And just to kind of just mention it, it's really interesting because, seeing now what is coming out of all of that research for HIV AIDS is like, I mean, to me, I was a young child and then teenager, in I was a young child in the 80s and a teenager in the 90s. And now it's like crazy, some of the things that you're hearing, and you're
Yeah.
like, oh my goodness, like this is making headway. But you'd hear about like the cocktail, like the different,
Yeah.
I guess different doses of different drugs. And
Mhm.
it's really interesting what's kind of become of that. But in this particular case, it was it cathartic for you to use some of that knowledge to write this horrifying book?
I'm not sure if cathartic is the right
Yeah,
word, but it
I'm like,
was,
that's not like what I mean, but it's a
yeah.
word. So what was it like? Like, did it help? Was there any processing that helped you too?
Not so much processing, but there was something that was really enjoyable about like being so fully in Meg's head. I very rarely write in first person. And of course, I say this as I'm currently editing another first person horror novel that's coming out next. So I very rarely write in first person. And I say that as I'm editing another horror novel in first person that's going to come out next year. But before this point, I kind of avoided it because I didn't feel like I could make it sound realistic. It sounded kind of hokey to me the way I would write it. I've done one more project in it, a vampire novella. It was fun, but it took having a character like Meg who has a very specific, like, the book is about her experience of being in her body and being her in a way that, I think third person would be too removed. First person is so powerful for being trapped in her skin the way she is. And also I had this idea going in that she's not narrating the events as they occur to her. She is narrating her memory of the events. And some of this is, I really enjoy Tana French's novels. And she does something very fun in those where she will just drop the most ominous, well, if I had only known what I know now lines. And they don't sound performative. They sound very like, I'm telling you the story and I'm laying my vulnerabilities bare, but I also still don't see parts of my own experience. And I wanted to do that with Meg. Meg is telling us the story of what happened to her so that she can understand what happened to her, because without turning it into a narrative, she is lost in this sea of what the hell just happened to me. And so, not so much writing a medical story being cathartic, but writing Meg's story was very immersive for me. And yeah, something about I feel like doing a medical story that is that person specific was engaging and intriguing and all the fun stuff. And both like enhances the horror, but also, it's I'm not Meg. I can set Meg on over here now and not be afraid of my own medical care.
With the structure of something as wild as this, did you write it in sequence? Or did you have like, I don't know, like a little cork board of hallucinations attached to post-it notes, attached to yarn of
I
different
pretty much
colors?
I pretty much wrote it in order. In fact, my editor at times was like, "Do you want to make it less chronological? Like, do you want to make it more chaotic?" And at a certain point, I was like, "I think this is going to be confusing enough that." And again, Meg is trying to put the pieces together. Now, there are times where Meg realizes that her understanding of something that happened cannot be true, but I just kind of leave it there for the reader to try and parse what they think might have actually happened. There's actually a moment in particular that, again, I'll have to talk around because spoilers, but it's a chapter that I wrote that my nurse friend who read the book went, Isabel would never do that. She's too good of a nurse for that. Like that's something that would only happen in like a movie or in like Grey's Anatomy. But like I can understand if maybe Meg thinks that's what happened, and I went, "Ooh, that's what Meg thinks happened." And there's now a really fun nursing progress note that happens in the book that is like one of the few times that Meg maybe gets to check what definitely is happening versus her perception of what's happening, and it kind of throws everything that happens before that and after that into question because she never gets a nursing progress note like that again.
Yeah, that was the other thing I wanted to ask a little bit about was you do a really good job of putting in those little doctor's notes and the whiteboard notes and things I guess that are supposed to be, I don't know, maybe encouraging or informative, but might also be upsetting.
Yeah. When I started like coming up with the concept for this book, one of the things in my notebook was use whiteboards for evil because anyone who's been in a hospital knows that your room has a whiteboard in it that is supposed to be kept updated, and it is the last thing on most people's mind because the nurses are busy, you're busy. It's kind of like it serves a good function, especially for people who are disoriented. If it's kept updated, you can see what day of the week it is, you can see who your care team is. It's good for if you forget your nurse's name, but for the most part, it like also feels a little bit patronizing because, like, for instance, like what if it has a little "get well soon" smiley face on it somewhere? Like just little things like that. And everyone has their own opinions about a numerical pain scale, right? Of what exactly is a 10 out of 10 for pain, sort of thing. And it was just a lot of fun to include those whiteboards and to do weird things with the whiteboard as the book progresses. I'm a big fan of House of Leaves and pretty much any book that messes with the formatting at some point. There's a book called A History of Glitter and Blood that's a YA novel that does fantastic things with form like that. I love when I get a chance to do that. I played with a little bit with something like that in my earlier book, The Death of Jane Lawrence, and with this one, I just went full for it in a couple places. And I also love like an in-world document. So, she checks my chart a bunch. She reads pathology notes. She tries to, and that's always useful to get seemingly objective information into the book where Meg wouldn't get it otherwise, or where she wouldn't be comfortable enough to ask. She can try and verify it herself. And it was just fun to inject those and to sometimes mess with them a little bit. So a reader might be like, okay, wait a second, that doesn't look right.
It reminded me very slightly of Horror Store by Grady Hendrix,
Mm-hmm.
how it's like an IKEA catalog. And
Mm-hmm.
I can't remember the name of the IKEA amalgam store in that book, but it starts off kind of normal with these cutesy Swedish type names for these probably very flimsy pieces of furniture. And as the book goes on and gets more menacing, so do the pictures and the descriptions of these items. It reminded me a little bit of that, which was fun because I like that too.
Yeah. It's fun. It's a nice little break from standard narrative stuff, I find.
Well, what are you working on next? Are you allowed to tell us?
Yeah. So up next, probably next fall, I already kind of mentioned it, is a vampire book that I have coming out. Right now, the title is Milk Teeth, but sales hasn't weighed in on that yet. Everyone likes Milk Teeth, so hopefully it stays. But that book, I like to, the quick pitch of it is, what if vampires had to breastfeed?
Wow.
And it is probably my squelchiest book ever. But the basic concept is, what if if you made a new vampire, that vampire needs to feed off of another vampire's blood for at least 3 years while they go through a bizarre but slow series of changes where they're not even fully like a person until that time passes. Because vampires are kind of inherently a selfish concept, and you can't matching that with like a very maternal nature doesn't seem to work very well. And especially if you're turning like your mortal boyfriend into a vampire, that makes things really weird. So I kind of went from that concept to creating a character who is essentially a vampiric nursemaid. She's called a brood mother in world, but she is better at feeding baby vampires than other vampires. She seems called to it, but as she takes on more and more baby vampires, things start getting weird because it's a book that I wrote. And she's trying to figure out what is happening to her body. So on the one hand, it's a very domestic book. It's a very like the changes your body goes through when you're postpartum and lactating book. I have a 3-year-old kid, you can do the math. But then it's also, I really wanted to lean into the inhumanity of vampires as a concept. These are not pretty vampires. These are not polite vampires. These are brood mothers tend to like to live in crypts, in gross sewers and things like that. And when vampires sleep in this world, they are essentially just dead bodies. So they have lividity and all these other terrible things. And there's also a lot of dental horror going on. So it's this weird, like, it's a domestic semi-thriller. Like, I think probably the closest equivalent would be Night Bitch, but it's also just, whenever I felt like things were getting a little bit too domestic, then suddenly there's a horrific murder scene involved. And I'm currently in the process of editing it. And I went into writing it because it's another first-person novel. Like I mentioned, that Meg is telling the story to herself to understand what happened to her. In Milk Teeth, our main character is narrating the story to somebody else from a place of confidence. And it's almost like a how you were born story. And that lends a really different character to it that I think is really fun. Aside from that, I've got a couple other things in the works. I don't think I can talk about them yet, but they're fun. At least one of them is a more fantasy horror project. Again, like my other book, my most recent book this year, The Starving Saints. Yeah, lots of fun stuff in the future.
Thanks so much. Check out The Graceview Patient, and I can't wait to see what you've got coming next. It sounds like exciting stuff. Once again, this was Jessica with Syosset Libraries Turn the Page podcast. Our guest was Caitlin Starling, and we are going to close this chapter.
It's time to close this chapter of Turn the Page. Join us for the next episode.